Why dentures are the best option after dental extractions. Wearing dentures after dental extractions can be a solution to an otherwise uncomfortable situation. Loss of a tooth in a 6-year-old is not only normal, but expected as well. When the loss of a tooth in an adult, however, has severe repercussions, even as dire as causing unexpected health problems. It is best for adults who lose more than one tooth after dental extractions to seek dentures. In what circumstances does one need a new tooth or teeth? Where can you get dentures, and what are the advantages? Let's look at these issues. Why a dentist may carry out dental extractions. There are several reasons why a dentist may recommend dental extractions. Among the most common is a cavity causing extensive damage to the tooth. Cavities are a gaping hole in a tooth, boring into the enamel or the outer and hard coating of the teeth. A cavity does not develop at once, but starts slowly. At its earliest stages, there is sensitivity in teeth, where one is unable to bite into foods of extreme temperatures. A tooth with a cavity also becomes brittle and breaks off when one bites into hard foods. It continues to widen as the tooth continues to bite and grind into food, eventually becoming a gaping hole causing toothache. If not stopped in time, a cavity can continue to chip off the tooth enamel and the dentine, eventually exposing the sensitive pulp to germs inside the mouth. Infection of the pulp is the main cause of toothache. Tooth extractions are final interventions, and most dentists will only recommend them when the tooth is too broken down for the patient to benefit from a tooth filling. Tooth extractions leave the person unable to chew and grind food. Therefore, after tooth extractions, a dentist may recommend dentures. Once a dentist performs a tooth extraction, what remains where there once was a tooth is a gaping hole of a different kind from the cavity. Why dentures are the next best thing after tooth extractions. The gap in the gum where the tooth once was is not painful unless infected, but it is extremely uncomfortable to have. Biting into food of any texture becomes an uncomfortable experience. Unable to chew and eat a proper diet, a gap in the gum impairs the patient's diet and hampers their nutritional intake. Teeth are essential to life, and dentures are the most important next step after tooth extractions. The dentist may recommend partial dentures or complete dentures to replace missing teeth. The most important value of dentures is restoring the ability to chew on foods of different textures. The other important value of dentures is to seal off the hole left in the gum. Since this hole is open, it's possible for germs to find their way into the bloodstream through it. A denture seals off the hole and ensures that the person is not at risk of a new infection. The other important value of dentures is the cosmetic value, helping the patient to cover the unsightly gap left by the missing tooth. A denture helps restore attractiveness after the loss of teeth.